Hello, and welcome to our video on blood typing. The precise amount of blood in a person's body will depend on their size. In addition, the blood's composition varies between individuals. This difference in structure is what makes a person's blood type. An individual's blood type depends on which genes they inherited from their parents. The main components of blood are red blood cells, which carry oxygen around the body; white blood cells, which play a crucial role in the immune system; plasma, which is a yellowish liquid that contains proteins and salts; and platelets, which enable clotting. The blood group will depend on which antigens are on the surface of the red blood cells. Antigens are molecules. They can either be proteins or sugars. The types and features of antigens can vary between individuals due to small genetic differences. The antigens in blood have various functions, including transporting other molecules into and out of the cell, maintaining the structure of red blood cells, and detecting unwanted cells that could cause illness. A blood type, also known as a blood group, is a classification of blood based on the presence and absence of antibodies and inherited antigenic substances on the surface of red blood cells, RBCs. These antigens may be proteins, carbohydrates, glycoproteins, or glycolipids, depending on the blood group system. Some of these antigens are also present on the surface of other types of cells of various tissues. Several of these red blood cell surface antigens can stem from one allele, or an alternative version of a gene, and collectively form a blood group system. Blood types are inherited and represent contributions from both parents of an individual. The two most important blood group systems are ABO and RH. They determine someone's blood type, A, B, AB, and O, with plus or minus denoting RHD status, for suitability in blood transfusion. The ABO blood group system involves two antigens and two antibodies found in human blood. The two antigens are antigen A and antigen B. The two antibodies are antibody A and antibody B. The antigens are present on the red blood cells and the antibodies in the serum. Regarding the antigen property of the blood, all human beings can be classified into four groups: those with antigen A, Group A; those with antigen B, Group B; those with antigen A and B, Group AB; and those with neither antigen, Group O. These antibodies present together with the antigens are found as follows: 1. Antigen A with antibody B; 2. Antigen B with antibody A; 3. Antigen AB with neither antibody A nor B; or 4. Antigen null, Group O, with both antibody A and B. There is an agglutination reaction between similar antigen and antibodies. For example, antigen A agglutinates the antibody A and antigen B agglutinates the antibody B. Thus, transfusion can be considered safe as long as the serum of the recipient does not contain antibodies for the blood cell antigens of the donor. The ABO system is the most important blood group system in human blood transfusion. Receiving blood from the wrong ABO group can be life-threatening. For example, if someone with Group B blood is given Group A blood, their anti-A antibodies will attack the Group A cells. This is why Group A blood must never be given to someone who has Group B blood, and vice versa. The RH system, meaning rhesus, is the second most significant blood group system in human blood transfusion, with currently 50 antigens. The most significant RH antigen is the D antigen, because it's the most likely to provoke an immune system response of the 5 main RH antigens. RH positive. People with Rh positive blood have Rh antigens on the surface of their red blood cells. People with Rh positive blood can receive Rh positive or Rh negative blood. Rh negative. People with Rh negative blood don't have Rh antigens. People with Rh negative blood can receive only blood that is also Rh negative. Together, the ABO and Rh grouping systems yield our complete blood type. There are 8 possible types: A positive and A negative, B positive and B negative, AB positive and AB negative, O positive and O negative. A person with O negative blood can donate to almost anyone. A person with Rh negative blood can donate to a person with Rh negative or Rh positive blood. And a person with Rh positive blood can only donate to someone with Rh positive blood. Type O negative has long been considered the universal donor. Comparatively, AB positive blood type is known as the universal recipient because AB positive patients can receive blood cells from all blood types. Blood typing is a method to tell which blood type people have. Blood typing is done prior to a blood transfusion or when classifying a person's blood for donation. Blood typing is a fast and easy way to ensure that you receive the right kind of blood during surgery or after an injury. Blood typing is especially important for pregnant people. How the test is performed. A blood sample, obviously, is needed. The test to determine your blood group is called ABO typing. To work out your blood group, your red cells are mixed with different antibody solutions. Then, the sample is checked to see whether or not the blood cells stick together. If the blood cells stick together, it means the blood reacted with one of the antibodies. If, for example, the solution contains anti-B antibodies and you have B antigens on your cells, your blood group B, it will clump together. If the blood does not react to any of the anti-A or anti-B antibodies, then it's blood group O. The second step is called back typing. The liquid part of your blood without cells, serum, is mixed with blood that is known to be type A and type B. People with type A blood have anti-B antibodies. People with type B blood have anti-A antibodies. Type O blood contains both types of antibodies. The two steps above can accurately determine your blood type. Rh typing uses a method similar to ABO typing. When blood typing is done to see if you have Rh factor on the surface of your red blood cells, the results will be one of these: Rh positive, positive, if you have this cell surface protein; Rh negative, or negative, if you do not have this cell surface protein. Blood type is inherited. Like eye color, blood type is passed genetically from our parents. Whether our blood type is type A, B, AB, or O, it's based on the blood types of our mother and father. A blood transfusion is a routine medical procedure in which donated blood is provided to the person through a narrow tube placed within a vein in the arm. This potentially life-saving procedure can help replace blood lost due to surgery or injury. A blood transfusion also can help if an illness prevents the body from making blood or some of the blood's components correctly. The blood will be tested before a transfusion to determine whether the person's blood type is A, B, AB, or O, and whether the blood is Rh positive or Rh negative. The donated blood used for the transfusion must be compatible with the person's blood type. If a unit of incompatible blood is transfused between a donor and a recipient, a severe acute hemolytic reaction with hemolysis, RBC destruction, kidney failure, and shock is likely to occur, and death is a possibility. It's also possible to use the patient's own blood for transfusion. This is called autologous blood transfusion, which is always compatible with the patient. Blood typing is especially important for pregnant people. A pregnant woman may carry a fetus with a blood type which is different from her own. Typically, this is an issue if an Rh- mother has a child with an Rh+ father, and the fetus ends up being Rh+ like the father. In those cases, the mother can make this specific blood group antibodies. This can happen if some of the fetus's blood cells pass into the mother's blood circulation. For example, a small fetal-maternal hemorrhage at the time of childbirth or obstetric intervention, or sometimes a therapeutic blood transfusion. This can cause Rh disease or some other forms of hemolytic disease in the newborn, HDN, in the current pregnancy and/or subsequent pregnancies. Sometimes this is lethal for the fetus. In these cases, it's called hydrops fetalis. In the cases where the mother is Rh- and the father is Rh+, the mother needs to receive a drug called RhoGAM. This drug will keep the mother's body from forming antibodies that may attack the baby's blood cells if their blood becomes mixed, which often happens during pregnancy. RhoGAM is the injection used to treat Rh incompatibility during pregnancy. This shot contains antibodies collected from plasma donors that stop the immune system from reacting to the baby's Rh-positive blood cells. Like other shots, RhoGAM is injected into the arm or the backside. Thank you for watching, and have a great day.